Good morning and welcome to the second annual CARE Conference.
We need to look at caregiving as a public health issue and just doing what's right for both the individual who wants to remain at home with their family, the caregiver wants to be able to care for their loved one, and just, this is better for everybody. There's always going to be a few situations where someone needs residential 24-hour care for their health or whatever, but it's just the right thing to do.
My story, she was born with a lot of problem, and we didn't expect any of that. So she was born with the heart problem, she was born with the brain problem, she was born with the liver problem, she was born with kidney problem. So my life turned upside down.
Life did change, and it changed dramatically in ways that I never thought it would, and it just, you always think that you're going to have more time than you actually do have. And sort of, I call it the arrogance of time. But it has transformed our lives in ways that are difficult, but also there are certainly blessings with it as well.
Typical day starts and ends, and when it ends, it starts over right away. So there's no break, really.
A typical day is getting her out of bed in the morning, getting her dressed, getting her medications into her. She does go to school, so she gets on the bus and we wave goodbye and I wait for her to come back. We are working on potty training and teaching her numbers and her letters, and teaching her how to use her speech device so she will be able to communicate with us, and she does pretty good at it. She's a lot of work, but she's wonderful.
I do whatever she needs all day. I feed her lunch, I change her, I get her to the bathroom, dinner, change her again. She goes to bed. That's when I'm usually most active. She goes to bed, and then every 2 hours for the rest of the night I'm up getting her medication. And every 2 hours from the time she gets up to the next day is 2 hours medication. Her life is in a small room, so it makes my life in a small room.
The roles I've had to play is one of a genetic student, a medical student, a case manager, an insurance expert, a special education advocate.
I think the hardest thing about my role as a caregiver is that I'm always worrying about what will happen if I'm not there.
Because a lot of the times you're always wondering and thinking, what's going on at home while I'm at work.
The hardest thing is watching the changes that they go through, the stages that they go through, not being able to do things that they used to be able to do, and helping them get through that. And the end stage is definitely the hardest because you have trouble living. So just how difficult could it be trying to live while you're dying?
Earlier on in my son's life, I did the general thing, probably the biggest mistake that most caregivers make, and thinking that I could do it all myself.
Right now in my life and taking care of Paula, I'm learning it the hard way that I need to take care of myself.
You can't be a patient and loving person if you're overtired and worn out. So finding time to take care of yourself is difficult when you don't have somebody else to take over for you.
I do ask for respite as part of the family support services. This is economical. This isn't just a nice service that you would be doing for families, although that would be true. But economically, you're either going to have families collapsing, and you're going to have to residential, and you're going to have to take nursing situations, et cetera, that cost a lot more. Or you're going to reap the reward of families staying together. You're going to reap the reward of not having residential, and you're going to reap the reward of really understanding what disabilities are part of our community. And so given all that, how can you say no? You can't.